All right, and Jeff, okay, so hopefully you're seeing the dialog box now. I see Jeff had a couple of questions in there. I'm gonna just say this out loud. The chat is disabled for the purposes of this meeting, but the question and answer box is available. And then I think, Tony, how do we mute and unmute folks?
I'm sorry, can you say that again?
How, if as people raise their hands, are we able to unmute them so that we can have them talk? Generally, as the host, there's like a little microphone to the right of the attendee's name.
I'm not showing anything but the panelists and the host, so.
Okay. Oh, so when you're looking at the participants, do you have two groups? So
Okay, I see 21 participants, and I can.
there's like a,
okay. Lower all attendees. Let me see. Well, it says they're all allowed to talk, so.
okay.
All right.
Interesting.
Yeah, I think we have a mute and unmute now.
Oh,
on our
perfect.
screens. Yeah.
Well, thank you very much.
All right.
So if you don't get that pop-up, basically we can continue forward. If you're uncomfortable with being recorded or the recording function, you can always revisit the webinar afterwards as it gets presented out. Did we have any other notes on the recording portion, Becky?
No, I think that's, if you're uncomfortable with the recording, feel free, if you want to exit now and then know that we are going to post the recording as a kind of a tool on the behavioral health integration webpage on the Healthcare Authority's website. But yeah, I think we've done due diligence there, and I think you can move forward. Thank you so much, Dylan.
Awesome. So getting started, my name is Dylan Ford. I'm a management analyst here and or project manager with the Medicaid Programs Division. And I'm here with Becky Carroll, who's the Deputy Director of MPD. And we have Tony, who is acting as the host, and she's really assisting with that Zoom, really fun tech stuff. And we're here to discuss the Behavioral Health Integration Grant for children and adolescents. So for the agenda of this meeting, we'll be doing an overview of the grant and what it is about. We'll be covering the grant requirements and the application, the evaluation process, our resources that we have out there, and then we'll be fielding any questions. And we'll also have that moment of kind of throughout, if you want to just use the hand up function to kind of see, make sure this isn't in your way. Oh, yeah, we'll have the opportunity where you can just kind of throw your hands up throughout. So just wanted to also give a heads up that we'll reach out via email with the answer if you do have a question and we don't quite have the answer to it, or if it is a high level question, we can go ahead and add it to the FAQ that is posted on the website after we do just a little bit of research and get it out there for everybody to see. And I'm going to go ahead and get started, and I'll be paying attention to the chat, and so will Becky, to kind of help throughout. So first off, we're just going to go over the overview of the grant. Now, when looking at the background of this particular grant, the state legislature has allotted about $2 million in total for a one-time grant for primary care clinics to establish behavioral health integration for children and adolescents. This grant is up to $200,000 per clinic. And just a key note that you don't have to request the full $200,000. If you have a project that needs less than that, please write it up in your grant proposal, which we'll discuss later as we get to the proposal section. And next, this grant is for primary care clinics who have identified the need to integrate behavioral health into their clinic model, and they're at the beginning of their BHI integration work. So here are some important dates to kind of remember. On February 10th, we have the webpage and application became available for this grant. February 27th, a pre-application webinar is so that's us right now. On March 22nd, we'll have the technical assistance and questions deadline. On the technical assistance and questions deadline, we set it this day before the application close, or the day before the application closes, because we would just hate to have questions coming in on the last day and not be able to answer them on the day that the application closes. We just want to give you that opportunity to, rectify any of those questions. And then on April, we'll have the awardees announced, and April through May, grant funding should be allocated. Just scroll through for any questions. Looks like we're good.
We're good, Dylan. I'll flag
All
you.
right. And then minimum qualifications of this grant is to be licensed to do business in Washington, or you can provide a commitment to become licensed in Washington within the 30 calendar days of being selected as a successful applicant. Primary care setting should be serving children and youth ages 18 and under. And you must accept Apple Health or Medicaid coverage without a managed care plan fee for service when Apple Health pays your provider directly. All right.
So to be really clear too, that's both fee for service and managed care. So all Apple Health plans. Yeah.
Correct.
Okay.
All right. And for money disbursement, recipients may use grants under this subsection for training to create operational workflows that promote team-based care and evidence-based practices, system development to implement universal screening of patients using the standardized assessment tools, development of a registry to track patient outcomes, behavioral health professionals, recruitment and retainment. And to be continued on that page, recipients may also use the grant and the subsection for psychiatric supervision, recruitment, and retainment for consultation services for BHI, partnership development with community mental health centers for referral of patients with higher level needs, IT infrastructure, including electronic health record adjustments and registry creation, and then physical space modifications. So if you're going to hire additional staff, you can use that money towards making those modifications to physical space. Just staring at the chat real quick in case there's any immediate questions right now. We're good.
So far, so good. Yeah.
All right. Up first, to be eligible for grants under this subsection, clinics must have at least 35% of clinics' total patients enrolled in Apple Health. And say we get a ton of applicants, priority funding given to clinics with the highest proportion of patients enrolled in Apple Health. So if need be, we'll use that proportionate to kind of determine funding. And then must have a primary care advocate or proponent of behavioral health integration. Support for behavioral health integration at the highest level of your clinic leadership, and an arrangement for psychiatric consultation and supervision. And then another eligibility requirement is a team-based approach to care. So that could be including primary care providers, behavioral health professionals, psychiatric consultant, and patient's family. Okay. And then for grant requirements, clinics must also have a plan to hire behavioral health professionals to be located in the clinic, create a registry that monitors patient engagement and system improvement. Must have a plan to implement universal screening for behavioral health needs, provide care coordination with schools, emergency departments, hospitals, and other points of care. Ensure closed loop referrals to specialty behavioral health care when indicated, as well as engagement in specialty treatment as clinically indicated. And up next, we'll kind of be diving into the application itself and doing just a walkthrough from the first page to last. So I'm just going to keep doing a double take at the chat to make sure there's no questions yet.
Looks good. I don't see any hands up either.
Awesome. All right. So here's the first page of the application.
Dylan,
And yeah,
I'm not sure, is there, maybe it's, hopefully, is this big enough for everyone to see? It might just be my side. Oh, there we go. I was having some issues on my side. My apologies. Go ahead, Dylan.
all right. I'll double look at the chat real quick in case anybody does say they can't see it. But the first thing on the application is a quick name of your primary care clinic, the primary care clinic NPI number, and then this is specifically the primary care clinic's physical address. So we want the specific clinic the grant is being requested for. And then we have the checklist here. This is just kind of to help assist you. Say you're like about to turn this thing in, you want to do a double take, that you have the application cover page, intake form, minimum qualifications, the grant application, narrative questions, and proposal. So the attachment 4 is just basically covering all those requirements that we just went over. The certifications and assurances, and then that COVID-19 vaccine certification form. And then once you believe you have all this information, you can go ahead and print the name and sign it. So first we have the chat again. Oh, we have a hand up in the chat. Phyllis. I see you have a question. I'll go back to that page. Is there a way to see the participant list? I don't know if you have that little thing at the top pane of the screen like this, but it kind of lets you click on it and it'll pop up like this. I don't know. Is there a way to show that? Or
So there, usually in the bottom part of your screen, there should be a bar along the bottom where you have a mute button and an unmute button, and it usually will have participants. You should be able to click on participants.
are we going to be?
Phyllis is not able to unmute. So Phyllis, have you attempted to unmute with the little microphone icon? I'm guessing not. I'm wondering, Tony, do you have a way of unmuting?
She's, let's see, she's allowed to talk. That's
Okay.
so I don't know why she's not able to. It says allowed to talk.
Okay. They're not seeing those icons. Interesting. So some people are seeing the microphone icons and some of them aren't. And my apologies for that. I'm not sure why that is. Phyllis, are you able to put your question in the chat box? I know that's less than desirable and certainly was not our intent. But I want to make sure that we've got your question down and that we at least try to answer it here.
What is the RFA number? Looks like that was the question. Let me go ahead and pull that up. And Becky, did we get a RFA number yet?
I don't think we have an RFA number. I was just looking for that. So Phyllis, we'll take that back and make sure we get you an RFA number. Get the whole group an RFA number.
All right, just noting down your question. All righty. So if you have the ability to speak, 'cause I see some people have the microphone next to their name when I'm looking at the participants list. And you have a question, feel free to, put your hand up and answer that way. But yeah, utilize this chat function, and then it gives us the option to kind of bring the questions back to our team a lot easier too. Chat, if anonymous attendee, chat is disabled, so are other symbols except Q&A. Okay. Does it give you like a button in the Q&A portion to say answer live or anything like that? Or ask live? Well, I'll move forward and hopefully we can figure that out. Okay, so here is the application intake form. And this really just has a lot more of that like outreach information that we need. So we have the identifying information, and that's the legal name, facility name, the UBI number, the TIN number, and the unique entity ID number, and the statewide vendor number. And also have the physical primary care clinic address. So we really want to make sure we get the actual clinic information and not just like the total organization information. We have the applicant primary contact info. So who to reach out to. And we have your applicant signatory, your clinic administrator contact information. And then we have your minimum qualifications. So checkbox if your organization qualifies. Licensed to do business in the state, as we mentioned before, must be primary care setting serving children and youth from birth to 18 years of age. Must accept Apple Health Medicaid for both Apple Health coverage without a managed care plan and Apple Health coverage with a managed care plan. So yeah, the fee for service and with managed care plans. Before I click forward, I'm going to stare at the chat box. So here we have the behavioral health integration grant, and this is where the application portion starts. So here's our priority questions, and we're looking for percent of pediatric clients birth through 18 years old enrolled in Apple Health in the specific clinic that you're applying for. And you can just drop it in any of these boxes. The percent of pediatric population who have a preferred language other than English. Percent of pediatric population who identify racially, ethnically as non-white, and that could be i.e. American Indian, Alaskan Native, Asian Black, African American, Native Hawaiian, Pacific Islander, Latino, Hispanic, multiracial in your clinic. I'm staring at this chat again real quick. All right. And then the next question is just the location of services for the specific clinic in question. And you can just drop wherever it is on here. All right. Now we're getting into the narrative questions of the application. So I believe in the application, you get one full page to answer each of these two questions. And the first one is, describe your clinic's arrangement for psychiatric consultation and supervision. An existing and current policy or procedure document will suffice. So if you have an arrangement for this already, go ahead and you can drop it. You can add the existing document, or you can discuss it in the chat. If you have plans to get an arrangement, say that you might be using the funds for that, go ahead and drop that in the chat and what those plans are. Or not in the chat, but in the narrative question.
In the application, right?
Yeah.
Yep, understood. I know we're kind of obsessed with the fact that we don't have a lot of functionality with the chat today. So go ahead, yeah.
And then Phyllis, I see your hand is still up. Do you still have a question, or is the hand left up from the last one? What billing codes do we use? Primary care codes or behavioral health codes? Becky, I'm gonna look at you on that one.
Happy to answer that question if I could get a little bit more context with that. So maybe let me type an answer to you. And so here we're not asking for codes necessarily. I think what we're doing is asking here for a policy or procedure that really describes your clinical arrangement. Not necessarily your billing codes. I don't know, Dylan, I could be forgetting. Do we ask for billing codes on this application?
Let me check back. The only place we ask for stuff is the UBI number, TIN, and then the
Yeah, nope,
these ones
all
here.
right. So maybe just I definitely, I'll pop something in the chat and let's see if we can resolve that.
All right. And then the next narrative question. So we have the arrangement for psychiatric consultation supervision. And then question number 2 is, describe your team-based approach to care and the types of providers that are in your clinic. And I'm staring at the chat again. The arrangement will be an agreement with the psychiatrist, and they will likely want to know how it's being billed. Okay, and I don't believe we need the billing codes when you're explaining that. You can probably just put the explanation in there of what you're doing.
Yeah, I think that we really want to understand the arrangement that the clinic has, how the referrals will be happening, how what that relationship is with the psychiatrist. So I think really what it would be is maybe an overview of the agreement, how your clinic's providers will be either interacting with these psychiatrists for a consultation, or how that psychiatrist will be providing supervision to a clinical plan for your patients, or if you're doing some sort of referral to a psychiatrist directly for additional services. I think a little bit of above and beyond there. I'm hoping that answers the question, Phyllis. And then we have another question in the chat as well. In the prior slide, it mentions funds for hiring in-clinic mental health provider. We've had openings for over 2 years, so I doubt this grant will help that. With contracting for telehealth just for our patients who would come to the clinic for appointments, and the telehealth would be initiated for this. So I think what you're asking, Kim, is whether or not you could use the funding for that. I think that's a really great question. I think I'm going to take that one back, Kim, and talk with our group about that. I don't think I hear or see anything in the proviso that would limit the way that referrals are done, but I just would like to talk with our internal group. So great question, Kim, and we'll get back to you on that one. So in description 1, Phyllis has a great question around, can we clarify what supervision in question 1 means? Supervision by whom? So I think what we're asking for there is if your clinical arrangement right now with a behavioral health provider includes psychiatric consultation and or supervision of activities by your providers and interactions with your clients. Matt, would you add anything to that? I mean, Dylan. So sorry. I'm looking at a bunch of names on my screen right now, so my apologies, Dylan.
No, I don't think there's not much
Okay.
I'd add to that. I think that was
Okay.
great. Hopefully that answers your question, Phyllis.
Yep.
Great questions again. All right. Any other questions on the team-based approach to care on the types of providers in your clinic? All right, I'll jump to the next slide. So here is the third part, and basically it's the grant proposal. How much are you requesting is really kind of the meat of this one, and provide a summary of the clinic's plan to use the funds to serve the intention of the grant. The grant proposal should also address the clinic's current state and plans utilizing the components below to integrate BHI. So that would be hire a behavioral health professional, create a registry that monitors patient engagement and symptom improvement, implement universal screening for behavioral health needs, provide care coordination with schools, emergency departments, hospitals, and other points of care, ensure closed loop referrals to behavioral health specialists where clinically indicated, engagement and specialty treatment.
So Dylan, we have a couple of questions, and I'm not sure, is there a word count restriction on the narrative questions? I know there's a page count, right?
Yeah, so there's the page count restriction. Initially, the proposal question of how much you're requesting, and you kind of describe what that's used for, would only take about 1 page.
Okay.
But we gave it 3 pages on the actual application because we know that these might be a little more wordy on the hiring behavioral health professional. And yeah, in that current state, you don't need to go into these giant specifics, but we do need a description of kind of what that current state is and any plans that you have utilizing them.
Okay. And Dylan, I think let's just double check with our IT team too to make sure there isn't an actual character or word count restriction. I know it's like I think 3 Word document pages is really what it is, the equivalent, but that's not a very specific answer to whoever the anonymous attendee is. I want to make sure we'll get an answer out to this group, and actually it'll just be posted as part of our FAQs. We also have a question from Elizabeth. How is the beginning of an integrative behavioral health program being defined? For example, if a clinic has begun an integrative behavioral health, but is still working on figuring out sustainability. So I think beginning of an integrated behavioral health, that's really a great question, Elizabeth. I think what we were trying to do was allow for some flexibility for clinics who maybe are in the early stages where they're trying to create those plans, and maybe they've done 1 or 2 of things to move towards sort of that integration. And we are also wanting to leave room for those who have been working steadily for a number of years around integration and wanting to, kind of figure out sustainability, which sounds like it might be your case. And I think we're happy to take that back as well to just provide a better written definition of that for the FAQs. That's a really good one. I don't think we really thought about that one. Internally.
Yeah, and we do have the definition of integrated behavioral health in regards to like this application. It's in the FAQs right now, and that was just posted last week on our website. If you
I
want,
think this is more specific about, whether or not, like at what stage are we, the beginning of integrated behavioral health. So maybe we just
Oh,
need to
okay.
provide a little more. I think we can come up with some sort of statement around that.
Great question. I'll go ahead and save that.
And I've got a note of that to you, Dylan, if that's helpful.
Awesome.
Yeah, I'm trying
Thank
to
you, Becky.
make sure we've got these all captured.
And then we have the question, what are the credentials of the behavioral health professionals we hired? Must be licensed, non-licensed, under supervision, pay for supervision as well.
Okay, so I think we're looking for hiring a behavioral health prevention professional that is licensed. So great call out, Phyllis. We'll make sure that we are specific on that in our FAQs. I don't think we're as prescriptive around whether or not you're paying for supervision as well, unless that is part of your grant proposal. So if you're proposing to use some of those funds for payment of supervision by a behavioral health professional, then certainly that would be part of your grant proposal, and we would want to see that in writing. So hopefully that's helpful there. And we'll add the licensed versus non-licensed to our FAQs as well, Phyllis, and make sure that we've got some specific answers in writing on the FAQs.
All right.
Dylan, yep, I think we're good there.
Great questions again. Thank you. So going to the next portion, and this is basically the certifications and assurances page, where you'll kind of want to read through it. And at the end, circle 1, are and or are not submitting proposed contract exceptions. And then signature of applicant's authorized representative. So we'll re-sign, title, and then date. And then we have our COVID-19 vaccine certification page. Basically, the solicitation is, I hereby certify on behalf of the firm identified below as follows, and check 1. And then I hereby certify under penalty of perjury under the laws of the state of Washington that the certifications herein are true and correct, and that I'm authorized to make these certifications on behalf of the firm listed herein.
So I'll note that this language will be very similar to those who receive the grant. We'll have to sign this again. I know we've gotten that question before on other grants. We do ask this in our application as a general practice, and then it does come back up again. If you are a lucky recipient, part of receiving those dollars will be funding a contract with the state of Washington to execute your grant proposal, and you'll see this language again for those of you who are interested in that. Let me see. And Phyllis has got a couple of other great questions in the chat, and I really do appreciate you all typing out your questions. Unfortunate that our tools are not working exactly the way they should, but let's see here. So I've got what tools may be used for measuring improvement. So I think that is in reference to a previous question. Dylan, did we want to go back in the application pages?
Yeah. Let me look here.
And I think, wasn't that part of, I feel like I'm conflating grant applications in my head. So I think creating a registry that monitors patient engagement and system improvement. I know we've got, or symptom improvement, right? I think that's one piece that we have that talks about improvement. Do we have another question in the application where we ask for metrics or improvement? I don't think so. So Phyllis, really like the question. I'm going to take that back. Off the cuff, I would say that we're looking for, access to behavioral health services that helps alleviate symptoms for clients, but that is not a specific answer. So let me just take that back to our group, and we'll get our FAQs posted about that. And then please clarify, define the two choices for the COVID attachment. Does the second box disqualify us for the grant?
Contractor is not able to perform in compliance with the vaccination proclamation. Contractor is not able to perform the contract obligations in compliance with the above referenced proclamation.
I think that's an attestation. I'm not sure that that would disqualify. I will double check with our internal team on that one as well, Phyllis. And I think as well on the universal screening tools, I don't think we're being as prescriptive of that. I don't think we're going to define the tools that are acceptable. So this, Dylan, is around the universal screening tools that are acceptable, our choice, Bright Futures. I think that again is part of the plan, right, Dylan? And so I think if we go back.
Yeah.
Yeah.
So we have a list under we have a list of recommended screening tools
Okay.
that I can look at to see if maybe that would help, and I can add that to the FAQ.
Let's do that. So we'll provide an update to that as well, Phyllis, on our FAQs, and for those of us who are listening along with us this afternoon. And I think that covers all the questions I see in the chat, or in the question and answer box so far.
So then kind of go to the evaluation stage. So what this would look like is we just basically, after applications are closed, we'll review the minimum qualifications. The narrative questions will be evaluated, and the grant proposal will be evaluated. And then lastly, we'll have a notification to the applicants after reviewing all that. So narrative questions wise, we have 20 maximum points available with 2 questions at 10 points each. They are reviewed by an evaluation team, which will determine if eligibility requirements were met. Evaluation team may meet to discuss the applications. Evaluations will only be based upon information that was provided in the applicant's application. So we're kind of just using a scale of 0 to 5, and 5 meaning excellent, 0 being non-responsive. The applicant provides substantive, can't say that word very well, descriptions and relevant details in addressing the narrative question. A sound understanding of the topic is demonstrated and includes pertinent examples. All criteria are fully addressed without identified weaknesses. And we kind of use this phrase going downwards. So it'll start with that, and then 4 being very good. When acknowledging an application, the applicant provides substantive descriptions and relevant details in addressing the narrative questions, but the response is not fully comprehensive, and any identified weaknesses will likely have just a minor impact on the success of the proposed project. Oh, sorry. And then 3 is acceptable. The applicant provides a basic response to the narrative question, but does not include details or supporting documentation. There are some gaps and lack of clarity in describing the application on implementation, and then identified weaknesses will likely have some impact on the successful implementation or proposed project, or of the proposed project. And then we go down to basically what's unacceptable is the applicant does not explicitly address the narrative question. The applicant organization states that the question, but does not, or states the question, but does not elaborate on the response. As a result, the answer is completely deficient in addressing the narrative question. And just a 0 or non-responsive, the applicant skips or otherwise ignores the question or includes irrelevant information that does not answer the question. As a result, the answer is non-responsive. So essentially, we want to know when answering these questions that we kind of have a description, that you understand the question, and your details address what is being asked of the narrative question, and that you have a sound understanding of kind of what's going on in this integration process.
And I will note the evaluation team is made up of members of, or made up of subject matter experts in this area. So behavioral health providers, integration specialists here at the agency, kind of a wide variety of folks. The applications will be looked at by at least 2 of the evaluators, and we'll be using this rubric really as a way of making sure we standardize the way that we're grading and looking at each of the questions that we're asking. And I'm not seeing any questions right now, Dylan. So, yeah.
And then same rules apply towards the grant proposal. It's 1 basic question, and then there's 10 maximum points available. As we said, reviewed by the evaluation team. Evaluation team may meet to discuss the applications, and evaluations will still only be based upon information that was provided in the applicant's application. So 5 being excellent here is the applicant provides substantive description and relevant details in addressing what the grant is used for, a sound understanding of their current state and future plans to meet the basic BHI planning requirements, and then all criteria is fully addressed without weaknesses or identified weaknesses. And kind of like stated before, going down to the non-responsive, and that's essentially the applicant skips or otherwise ignores the question or includes irrelevant information that does not answer the question. As a result, the answer is non-responsive. And I'll give it 1 minute here in case another question pops in.
Not seeing anything.
All right. So now we're going to jump into the resources. First, we have the pathway to getting to the website. It's on the Healthcare Authority. You go to the homepage, about HCA, programs and initiatives, behavioral health and recovery, what we're working on, and then boom, behavioral health integration grant. And I also posted the URL in here. On the website, we have the overview. We have the application itself that you can find. And then we have the behavioral health integration grant, or grant FAQ. Now, we have everything on there right now that is super useful. But if you take the time after this webinar, we should have it updated with a lot of the questions that we've gotten today.
And we'll work on the questions that you've posed in the meeting. And we'll try to get answers updated on that FAQ here pretty quickly. Recognizing it's Monday, I'm hoping we can do that by Friday, but again, we'll make sure that we do that quickly. So I would check back on the website Thursday or Friday for updates to that. We also have our dedicated email box, right? And is that on the, oh, perfect. Thank you,
Yes.
Dylan.
So the email box, it's on the website and it's on the overview as well. But if you have any questions at all, feel free to just reach out and we'll be monitoring the inbox. And we basically, if you send your questions to there, we can immediately take them back to our team and kind of get those reviewed with proper timing, and then we'll respond. But for right now, this was the last slide of the webinar. Is there any questions? Thank you all for kind of taking on those errors that we had here with the sound not working on your end.
I know. So Dylan, we have one from Kim, and she's asking if the Zoom webinar will be available to watch as a recording. It will, Kim, and we will have that posted on our webpage. So after watching that and looking at the information on the webpage, if you feel like you still have questions or you need some additional information, you can always reach out to the email box on the screen right now. We will be updating the FAQs. Really great questions this morning. So really do appreciate the engagement. I think we have, I'm counting somewhere in the neighborhood of 10 or so questions to provide some additional information back on.
All right. And then I think I said at the beginning, the FAQ is kind of going to be updated. And I think Becky might have just said it too, to address all the questions that have been brought up at a higher level.
Absolutely. I don't think we can say it enough, Dylan, right?
Yep.
We recognize that you need that information to ensure that your proposal is complete. So we will do our best to get those answers as quickly as we can. I know we are being very slow here to end. Happy to give everyone back some time in their day. I really do appreciate your engagement and your interest in the grant. We are really excited about this opportunity here at the Healthcare Authority. Still not seeing any new questions. I don't know, Dylan, anything else to close out today?
Nope. I think that was about it. And yeah, if like I said, if you haven't seen the FAQ yet, we posted it last week and it is on the website right now. Thank you all for your time. And yeah, great questions.
Appreciate the interest. All right, thank you all.
Yep. Have a good day. Bye.
Oh, you know, Dylan, I just saw that we got another question from Jeff. Is HCA looking for local primary care clinics that specialize with youth 18 and under and want to add behavioral health services, or behavioral health clinics that are adding primary care? And it is, I think we're going to get that a few times. So I think really what we're looking for here is pretty prescriptive in the, for those of you who may still be on, pretty prescriptive in the proviso itself, that we're looking at primary care clinics who are serving youth 18 and under who are in the process of integrating behavioral health, or who have a plan to do so. So really not in the reverse, unfortunately, this time for behavioral clinics that are looking to add primary care, although we do appreciate the effort and energy that it takes to do that as well. So Dylan, we'll add that to the FAQ questions. I think we did receive a similar question already this week or last week. Last week it would have been, it's only Monday.
Yes, we did receive a similar question. So yeah, we'll go ahead and add that to it.
All right, well, at least it's on the recording. I think there's still a couple of attendees here, so at least they heard it, and hopefully we captured it in the recording. So with that, I think we can end the webinar. What do you think, Dylan?
I think so. Everybody have a good day. Bye.
Bye-bye.
Hey, Becky?
Yes, Tony.
Yeah, I'm thinking, I got in a Teams message to Missy Sterling, the one that's really good with Zoom. And I think that when it was set up, something wasn't checked as far as being so, and then I just didn't have an option to change that on here and where. So we'll just have to make sure that's set up correctly at the very beginning when whoever set the the meetings up, that they do that. So okay,
that makes sense.
Okay.
Thanks, Tony, and thanks for being such a good sport. I know I kept asking, and it feels like I put you on the spot, but I appreciate your help.
I've learned a lot. I've set up meetings, but I've never run one, so this was good for me.
Oh, good.
Okay, great.
Okay, and I think if we can get I don't know if it allows a copy for the Q&A, and if it doesn't, Dylan, I have it copied and paste that into a Word document. I'll share it with you right now.
Okay, awesome. And you can stop recording. Are you going to call me on Teams by chance?